Hey guys, hi, welcome back to Unacademy. This is Unacademy Future Doctors, and I'm your educator for biochemistry, Dr. Shivangi. Um, Let me just check if I'm visible and audible to all of you. Let me just check if the live stream has started or not, and then we can continue. Give me a okay, great. So, um, I have been taking a lot of classes these days, back to back classes. Um, I have completed the super fast crash course of entire syllabus of biochemistry in rapid manner, the rapid revisions, all the important topics. Now I have started the focus series, which focuses on comprehensive learning of each and every topic in depth. Okay. Now, keeping in view the rising number of COVID cases, the unprecedented rise in the COVID scenario of this pandemic, the third wave in our country, I have decided to take a few sessions regarding COVID. Yesterday, what we discussed was about the investigations related to COVID and the structure of COVID. That is very important for biochemistry. Tonight, we discussed about the various frequently asked questions regarding vaccination with respect to COVID. And now I am taking an extremely important session whose importance just cannot be justified by words. And this session is COVID-19 and mental. Okay, so please, all of you who are attending this live, do focus on it. Those of you who are not able to attend this live, do watch the recorded session and spread it amongst all your near and dear ones, everyone that you know, because it is very important in today's scenario where mental health has been ignored and COVID has been affecting mental. The only the physical aspect of health has been catered to largely. Most of us ignore the effects that COVID-19 takes on the toll that COVID-19 takes on our mental health. So tonight I'm going to address that and help all of you to prevent the effects, the ill effects, and those of you who are suffering from it, I'll help you get out of it slowly. Okay. Um, so before starting, I'll just take you through the different types of subscriptions for NEET PG that are available on Unacademy. The Iconic as well as the Plus subscription offers you access to video lectures from top educators across the country and their PDF notes, a question bank, regularly updated, exhaustive, comprehensive question bank, and utilizing state of the art tools like raise your hand feature, ask it out feature, and live polls during the class. The Iconic subscription additionally gives you access to resources from Prep Ladder as well. Okay, so given the present scenario, it is very important for you guys to try out the online platform to ensure regularity in your learning. Okay, so please try this out. It is very extremely inexpensive compared to the other coachings. And do not forget to put in the educator code DRSHUKLA as mentioned here. So whenever you are checking out on the app, this code DRSHUKLA is going to fetch you an additional 10% discount. 10% is a huge amount. So please do avail of this. All right. Now coming on to our main topic for tonight, that is COVID-19 and mental health. All right. Now, what are the various issues regarding mental health that crop up while talking about COVID-19? Okay. Now, the first and foremost response is stress and anxiety. Why? Because this disease, not much is known about it. This disease is comparatively new. So even the healthcare workers, the government, the administration, they also tend to get baffled and bogged down by the enormity and the uncertainty that is surrounding the existence of this disease. Okay, none of the countries in the world have experienced this disease before. There have been similar instances. There have been similar coronaviruses that have come. This new strain is the first one. It has unique characteristics. It has unique transmissibility, unique symptoms, and because it is a viral disease, there's not much regarding the drugs or the medications that can be given. Also, this virus has a very high mutability rate or a very high mutagenesis, and it has a very high variability rate. Variations are small changes in the virus. Mutations are big or huge changes in the genome of the virus. Okay, it is a complete jump in the mutation, whereas variations are small shifts. Okay, now like the influenza virus is also highly variable. It undergoes a lot of variations in different seasons. Therefore, different types of influenza like H1N1, H7N1, H7N5, different types of influenza like bird flu, swine flu, they can influenza type A, different types of influenza can occur. Okay. Similarly, this COVID virus, it is first of all, it is extremely highly transmissible, very contagious. So, and not much is known about this disease. Other thing that people are very apprehensive about is the COVID pneumonia, because it is not just limited to the upper respiratory tract. It can lead to COVID pneumonia, which can lead to a severe disease. Also, it can lead to inflammatory changes. So, inflammatory changes in the body are the most um, are something that are causing the most amount of apprehension. They are the most dreaded. Okay. Also, because this disease is so highly transmissible that it puts a huge load on the healthcare infrastructure, and the healthcare system is not able to contain the spread of it is not able to manage with the available resources, with the limited resources. It is not able to manage. In almost all the countries this happens, that the healthcare system gets overburdened, the resources and the manpower gets exhausted because of the rapidity with which this disease spreads. Okay, so these are the features that are leading to a lot of anxiety. Also, the increased awareness on the social media, increased coverage by the news media, and most of all, the sensationalization that surrounds with negative news, that leads to whenever the negative news gets circulated for want of sensationalization, that leads to a lot of apprehension amongst the general public. Okay, so the most important features, the most important mental health issues are stress, anxiety, fear, very important, grief. Okay, grief because of a lot of things, because of loss of employment. Yeah, this is also one very major issue where a lot of people are facing loss of employment. Governments are facing a hit, a blow to the economy. There is strain or stress in the personal relationships. A lot of marital discord is happening. Then what happens is, because of lockdowns, people have reduced interaction. Because of lockdowns, there is reduced interpersonal interaction. So that also leads to built up of a lot of grief, anxiety, and stress. Okay, grief can also be due to loss of someone, grief, morbidity, mortality, uh, uh, difficulty in due to decreased recreational activity. Okay, all these things can lead. Depression, now a severe form, a prolonged form of grief and stress, will lead to depression, clinical depression. Okay, which can be diagnosed by the doctor. All right, low mood all the time, extremes of emotions, low mood, ex hyper decreased appetite or hyperphaging, that means decreased appetite. Okay, then it can be involuntary crying, involuntary smiling, or difficulty to arouse from the bed, inability to get up from the bed and get to work, or get to even carry out the activities of daily living. Okay, these are a few of the symptoms that characterize depression. decreased will, okay, in loss of will or loss of pleasure in any of the activities. Okay, see, it has these characteristics of hopelessness, helplessness, worthlessness. These are the triad of depression. Hopelessness, that there is no hope left in the world for me. The person thinks there's no hope left in the world for me. There is nothing in this world for me. Helplessness, there is no hope left in this world, but I cannot do anything about it. Okay? There is no hope left in this world for me. There is nothing that is left here for me. I cannot do anything about it, and I am so worthless that I cannot do anything. Understood? So this is the triad of depression that exists, that occurs when the people are suffering from mental health, especially related to COVID-19. The other symptoms. Okay. Anhedonia is also a symptom. Anhedonia means loss of motivation. There is no motivation in anything. Even carrying out the activities of daily living, the person has is not motivated. Okay, he has lost interest. Nothing is interesting enough for him. Okay, then psychosis, an extreme form of anxiety, is going to lead to psychosis, where the person starts um, imagining things. The person can start hallucinating. The person can start having illusions, delusions, misplaced conceptions about things. Okay, so this is an extreme form of anxiety. Okay, then the person can have post traumatic stress disorder or PTSD. This usually occurs when the person has experienced severe grief, okay, and inexplicable trauma, sudden trauma, severe grief, especially like maybe loss of some person, or loss of the livelihood, okay, anything of which is an extreme trauma to the person. This person can experience post traumatic stress disorder, where he will have recollections, mental recollections of that trauma, experience anxiety, depression, and loss of motivation, loss of any will to do anything, suicidal tendency. All right. So these are the important mental health issues that a person can experience in these scenarios. Okay, there can be exaggeration of, there can be even worsening of the already existing mental health issues in people who have, or who have previously been undiagnosed, but they have been suffering from some or the other disease. So there can be unmasking of that problems during this pandemic. Okay, understood. Now, what should people do about this? Okay, see, for those who have already been suffering from mental health issues, and now addition, the most important management part in any mental health issue is to develop interpersonal relationships, good interpersonal relationships, to increase, to develop hobbies, to practice, to increase their physical activity levels, exercise levels, so that the balance of neurotransmitters and hormones inside the body is maintained. There's release of endorphins and good hormones, okay, feel good hormones. But what has happened with COVID-19, people are largely generally restricted inside the restricted to the confines of their homes. So what happens is their interpersonal relationship has suffered, their interaction with others has suffered, and they have been reduced, they have been limited to just themselves. So what happens is the mental health issues get compounded in solitude. Okay. Therefore, what happens is the management is limited, and it has to be tailored according to the present scenario, because we have to balance both the physical as well as the mental health. Because rising stress, anxiety, all these can lead to imbalance. It can lead to an imbalance of hormones. It can lead to hypersecretion of cortisol, which is an immunosuppressant hormone. It really send your immune system toward for a toss, and that can ultimately lead you into a vicious cycle. It can lead the person into a vicious cycle of decreased immune system, the immune system gets then the body's functions get disturbed, and the person is physically hampered, and then it can further lead to hampering of the mental health, which further lead to stress, and the cycle continues. Okay, so to break this cycle, we have to develop a few habits. That is what I'm going to tell you about. Okay, now what are these habits? The first and foremost is regular physical activity. Okay, now during COVID, what has happened is we have experienced a lot of lockdowns. Okay, different levels of lockdowns, very strict ones, and then gradually they have been relieved. Now these lockdowns, curfews, weekend curfews, night curfews, all these are in the general good, for the greater good, for the good of the public. Their application, the application of lockdowns is very vital to contain the spread of COVID. Okay? If the lockdowns are not uh, put in place, then the spread of COVID can go out of control. It can boom out of proportion, as has been experienced in a lot of countries. Okay, so ensuring a proper and an early lockdown before the COVID virus starts spreading in the community is the need of the hour every time the cases start rising. Okay, now in that scenario, you have to ensure that your physical activity is tailored according to the confines of your home. Now, what you can do inside your house is brisk walking inside the room itself. Then, what you can do is aerobic activities, Zumba, very good aerobic activities, and they help in maintaining your shape, your weight. Dancing, you can practice dancing, extremely very good to maintain your weight. All these are good aerobic activities that you can continue in the confines of your home. If you're into strength training, then you can use dumbbells inside your home. Okay, and you can train your even if you don't have dumbbells, you can utilize 1 liter bottles, 2 liter bottles, filled bottles, and you can use them to lift weights. Okay, because there are a lot of ways in which you can you can continue exercising inside the confines of your home. Okay, ensure that your house is properly ventilated and you are adequately hydrated throughout the exercise. So a regular physical activity of about 45 minutes around 5 days a week is extremely essential for you to maintain your weight, for you to maintain your heart health, and for you to maintain your immune system functioning optimally. All right. Hi, Jatin is saying, ma'am, make ATCOM. That was in biochem syllabus. Jatin, I'm at it. I'm going to take the ATCOM module sessions as also for biochemistry. Not worry, I'm going to take because they are there. They are included in your first year syllabus. Okay. Yeah. So these are the important. Jatin, that is what I'm discussing. Okay. Focus on all these factors that are very important. Okay. Now, so physical activity is the first and foremost which should be undertaken by all of you. Okay, regular physical activity, cardio exercises are those that involve usually the aerobic exercises. Cardio exercises, you can most people they have a treadmill or a cycle at home, the gym cycle, so they can use that. Okay, if even if you don't have any equipment, I've told you you can dance, you can do aerobics, you can walk briskly inside your room to and fro, pace around your room. Okay, and you can do some stretches. There are a lot of HIIT workouts that are high intensity interval training workouts. They are extremely beneficial, in which you perform high intensity exercises in short intervals. Okay, short and fast intervals. When you try them out, they should be practiced by those having high functional capacity, as well as especially those the youngsters, because they require a lot of high intensity activity. Also, the exercises should be done monitored by some professionals, like you can talk to your doctors or your physiotherapist on phone and can perform the exercises, or especially those with osteoporosis or heart conditions, or any orthopedic conditions like spondylosis or uh, paraventricular interventricular uh, disc prolapse, PIVD. These people should avoid a few exercises which have, and therefore they should consult their doctors before starting any regimen online. Okay. Next is yoga and meditation. It is very important. Its importance cannot be stressed much. It cannot be stressed enough. Its importance. Yoga, you can practice yoga, regular yoga exercises that have been popularized throughout the world. So you belonging to the country where yoga was initiated, should also utilize its benefits. Okay. And the different asanas, especially those that increase your respiratory capacity, they should be practiced. Surya Namaskars, they are very great asanas to be practiced for improving aerobic capacity and also for improving the strength and posture of your body. Okay, your muscles can get toned very rapidly and very easily with Surya Namaskar. Meditation is also very important to reduce stress, to decrease the effect that stressful news has on you, to increase your concentration abilities. So yoga and meditation also increase your concentration abilities, especially if you're students or if you're someone who gets very easily bothered with the negative news or the negativity around. It is very important for you to have regular meditation sessions which will increase your concentration ability, your ability to ward off negative news. Okay. Next, extremely important thing is to avoid your addiction to drugs, tobacco, and alcohol. Okay. Now, especially because alcohol is immunosuppressive, along chronic alcoholism is leading to reduction in immune, will lead to disruption or imbalance in hormones. It is going to contribute to obesity, and it is going to contribute to diabetes and metabolic syndrome. So all these are immunosuppressive, and they are going to lower a person's immunity towards COVID. Then moderate consumption of alcohol is okay, because especially red wine, because it is cardioprotective. Moderate consumption, it is fixed and it can be discussed with the nutritionist or the doctor. Okay. Tobacco consumption, tobacco should be stopped. It should be banned, but it should be avoided totally, because COVID, as you can see, it is a respiratory virus. It affects mostly the respiratory system. So tobacco is, it will already send your respiratory system for a toss. So it should be avoided for you. Any kind of hurt or damage to the respiratory system is unwarranted. Okay, drugs should be avoided in any case, not just in this scenario, but in any case. Okay, because they are going to ruin your health further, not just physical but mental as well. They are going to lead to dependencies. Now, it can lead to addictions. Okay? So, in this scenario where it is difficult, where it is actually it is and you are encouraged not to step out of the house unless and until the reason is an emergency. You should not step out of the house for addictions like these. Okay, because they are only overcrowding at places, because people tend to crowd at some places and then consume these. So it is going to lead to spread of the disease as well, and not just it hamper your mental health. Okay. Now, you should increase the intake of proteins, fruits, and vegetables, because they are going to increase your immunity, make you feel uh, lighter, because avoid a lot of sugary stuff, avoid a lot of empty calories, okay? And fatty food, please avoid all that because it is going to make you feel very bloated, affect your digestive system, and in turn affect your mood. Okay, so consumption of a lot of fruits and vegetables, they will decrease the production of free radicals inside your body and improve your health. Fruits and vegetables have natural antioxidants, which will improve your health, which will increase the ability of the immune system to fight diseases. Okay, and protein, the importance of protein is has been stressed enough in the case of COVID-19, where a regular consumption of a high protein diet is going to increase the body's immune system. Why? Because the immunoglobulins are proteins only. Okay, most of the biomolecules inside our body that are involved in the immune system are ultimately protein. So fruits and vegetables offer vitamins, minerals, which are important cofactors in different enzymes, synthesis of hormones. Okay, so regulation of hormonal activity is very, very important, and the antioxidants and proteins are helpful in that. Okay, dumbbell. Hey, hi, dumbbell. Nice name. We were just discussing about the regular physical activity where I mentioned you can use dumbbells inside your home if whenever there are lockdowns and you're not allowed to go to the gym for public health purposes, then you can use dumbbells inside your home. Did you see? Did you hear that? So, are you a gym freak? Are you why this name? I'm intrigued. Yes, dumbbell, USMLE and PLAB exam. I can take this up later on. Right now, we're discussing about COVID-19 and mental health. So let us focus here. Whenever I'm discussing about the entrance exams or NEET PG exams or USMLE for further studies for PG outside, PLAB for PG in UK, in the UK, then we'll discuss this. Okay, right now let us focus our mental capacities on mental health right now. Okay, now one very important thing which has been utilized also in this scenario in the past 2.5 years is developing a lot of hobbies. Okay, people have developed cooking. It's all over the social media. They have been baking, cooking, trying out dalgona coffee, isn't it? There are a lot of things that they have been trying out. So it is all to maintain their sanity, okay, to avoid getting influenced with the negative news. Why? Because developing hobbies is going to increase the positive reinforcement inside you. It is going to positively reinforce you. It is going to increase the secretion of feel good hormones like endorphins, serotonin, dopamine inside you. Whenever you achieve something, whenever you are able to uh, say master one dish, master a particular dish, there is release of dopamine inside you, and that is going to increase, that is going to make you feel good. So therefore this is what hobbies do. Hobbies increase the feel good hormones like dopamine, serotonin. Regular exercise increases endorphins. So these are the hormones that increase the positivity inside you, and there it is, these hobbies are able to ward off the negativities from your life. Okay, so it is very important to develop hobbies like music, like music, maybe playing some instruments, singing, dancing, or whatever. In the age of the internet, this internet boom has provided you with enough opportunities to develop any hobbies. Look that up on YouTube, on Google, and then you can try it out. Okay, but always ensure that you are supervised by some professional, or if you're a minor, then you are supervised by an adult. Okay, and yeah, and ensure that you stay clear of addictions. Okay, now it is very extremely important to spend time with your family. Okay, this lockdown can be considered to be a blessing in disguise, where you get a lot of time with your family. The working professionals who are working from home get a lot of time to spend with their family, which they couldn't earlier. A lot of travel time is saved, and it can lead to reduction in the road rage incidents. Then people who were earlier students, who were staying away from home in hostels, they can come back because they are now they can do online learning like this, and they can spend time with their family also. So this time should be taken, utilized to spend time with your family, talk, to develop interpersonal relationships, to share your feelings, whatever you're feeling, be it grief, be it anxiety, be it fear. You should have someone to share that with, and in turn you should be someone who lends a patient ear to someone in grief, in anxiety, in depression, in fear. Okay, and you should try and help others. Understood? Another very important thing is to limit screen time. Okay, because continuously being in front of the screen also affects hormonal activity, especially if it affects your circadian rhythm. Okay, there is something called cyclical dysthymia. What is cyclical dysthymia? It is low mood that affects people in certain seasons. Okay, that is due to um, dysfunction in the release of melatonin. Melatonin is the hormone that gets synthesized from the amino acid tryptophan. We have studied how in biochemistry tryptophan gets converted to 5-hydroxytryptamine, which gets converted to serotonin, which is converted to melatonin through hydroxyindole methyl transfer. This transferase. This is the enzyme. So this melatonin is important to regulate the circadian rhythm inside our body. That is the sleep cycle, the sleep-wake cycle. So our body is programmed function optimally when it wakes with the sunrise and it sleeps after sunset. Okay. So if the circadian rhythm gets disturbed or gets reversed, then the release of melatonin also gets disrupted, and it leads to low mood, different hormones that are programmed to be released diurnally or nocturnally, that also gets shifted. Okay, so you should limit your screen time so that your circadian rhythm is not affected. Okay, just a second. Thank it's okay, Luke. I'm happy that you liked it. And so this is the importance of limiting screen time. Okay, because the maximum, if you keep, there has been a lot of boom in the online platform. Okay, the over the top online uh, web series and all in have boomed during COVID-19. Why? Because most of the movies, most of the web series have come up. Okay, so this is one very important way to keep yourself entertained, to keep yourself stress free, to distract yourself. But you should limit this, because if you keep on binge watching throughout the night, then your hormones will go for a toss, and that is going to affect your mental health. Okay, so your sleep wake cycle should be maintained. All right, now avoid negative news. Okay, so most of the channels, they would be showing today this was the toll of the COVID cases, this much active cases, these total cases, the COVID has been rising, has been doubling, and this is the fate in this state. These are such sad stories and accidents that are happening. Such and such is the state of the hospitals, of the healthcare system. So all these things, if they are affecting you a lot, you can just know, you should be able to filter out the negative news from the positive news, and only the positive news from the negative news, and only focus on the positive news. Okay, the positive news or the neutral news, that is the facts regarding COVID. Okay, whatever you should follow for your own safety, for your own health, those things you should be able to filter out. Please avoid any sensational news, any negative news, because that is going to do uh, development of a lot of stress and anxiety. That in turn will lead to lowering of your immune response, and that will affect not just your mental but also your physical. Okay, so avoid negative news, avoid negative people, avoid all sorts of negativity. Just be negative on RT-PCR. All right. Now you should never stay back from helping someone in need. Uh, okay, so anyone who requires, especially the house helps, the maids, the any support staff that you have who are in need of money. So you should always be ready, because if God has blessed you with the means to serve the poor, then you should be able, you should utilize that opportunity, utilize that gift to help the poor whenever they are in need. Okay, only inside within your means. Okay, you should not, I'm just telling you to be within your means and then help someone who is in need. Okay, because this is a time which is unprecedented. Okay, could also help if someone who is better off than us would extend a hand to help us. So similarly, we should also be sympathetic and empathetic towards the others, and we should not shy away from helping others who are in need. Okay, you can maybe buy masks for your house helps who are unable to buy that, buy sanitizers, you can help them in getting vaccinated. Okay, you can help them getting medications, buying medications for their family. So these are the few things you can help them. If during the lockdown they're unable to visit you, they're unable to come for duty, still it will be appreciated if you don't cut their salaries. Okay? Because everyone is in this together, isn't it? Okay, all right. Yeah. Now, yeah, one very important thing is to ensure adequate rest and hydration. Okay, hydration is extremely important to flush out toxins from your body, to prevent dehydration, and to ensure a regular supply of hormones and a good digestive system. If your digestive system is good, then there are good probiotic bacteria inside your gut, and these probiotic bacteria also contribute to immunity. Okay, especially against viral illnesses. Very, very important to ensure good hydration by eating fresh fruits, avoiding fatty food, and ensuring adequate hydration. Okay, ensuring adequate rest means you should sleep for all continuously for at least 8 hours. Okay, it is extremely important to sleep for at least 8 hours, not less than 6 hours every day. Okay, very, very important to maintain a regular sleep wake cycle. Okay, got it. So this is yeah, and this is extreme. This is given that obviously you should follow all the safety norms and precautions, and you should avoid to. You should be masked. You should use masks. You should use sanitizers. You should ensure hand hygiene. You should ensure your nails are cut, and should ensure that you are maintaining social distance, because all that is going to lead to positive reinforcement. It is going to lead to secretion of good hormones, happy hormones inside you, and it is going to make you happy because you have achieved something. You have fulfilled the safety precautions, and your mind knows that you have done something good. You have not violated any norms. Okay, so you are staying within um, safety. Okay, now the technology that is on social media and the phone, internet, all of these things you should use, especially video calls over different platforms, you should use to stay in touch with those of your family who are not staying together, maybe staying abroad, staying in different states, different cities. Okay, and you cannot visit them because of lockdown, because of ensuring social distancing. So you should use that to stay in touch, especially for those who are quarantined or in staying in isolation. They also tend to get experience a lot of low mood, stress, grief, because of separation or because of not being able to talk to someone. So you should utilize technology during that time. All right. And lastly, If at all none of this works and you are experiencing worsening mood, worsening symptoms, then you should, without hesitation, without any sort of stigma, you should not stay back from calling up, or from calling up the helpline that is provided by the government for mental health, or from visiting the doctor. Okay, anyone that you know, any doctor that you know, or any of your friends who are health specialists and medical specialists, or even if you don't know anyone, you can visit the nearest health clinic to talk about your condition and to seek help, because it is none of this should be stigmatized. It is very common. Almost every other person is suffering from some mental health issue or the other. Okay, so you should never hesitate to seek help. All right, it should never be stigmatized. Those who stigmatize mental health are backward people. Okay, their thinking is obnoxious. Okay, so you should be forward thinking, you should be modern, and you should be human enough to know that mental health issues do exist, and they are as common, if not more, than physical health issues, and they need to be treated just like any other physical health issue. COVID related mental health issues like anger, grief, anxiety, fear, restlessness, depression, uh, low mood, hopelessness, helplessness, worthlessness, anhedonia, um, uh, no will to do anything in life. Okay, and apprehension, frustration about the state of things. All of this somehow or the other contributes to our mental health. Okay, and it should be addressed, it should be accepted by the person, it should be accepted by you. All the means that I have told you to alter your mental health towards a positive state, they should be followed. If still you are experiencing depression or worsening of symptoms, any sort of symptoms, then you should not stay back from seeking help from a qualified medical professional. Okay, all right. Thank you then. Good night, guys. If you haven't subscribed to this channel, then do subscribe to it. And thank you, Abdullah. Okay, bye bye, guys. Thank you.